Hi everyone, welcome to Center of Balance Live. I'm Szenan-Balance from Center of Balance, the acupuncturist. Now this is New Zealand time, 9:15 p.m. Today we're going to talk about acupressure points for knee injury recovery. I know if you um, um, injured your knee, the first thing you probably go to see a doctor, right? Or physiotherapists. We're talking about acupain. With the acupain, you may get swelling, right? Swelling around the knee. In this case, most practitioner, they won't do anything for you. They just send you home, and they may just suggest X-ray. Make sure there's no broken bone, or ultrasound, things like that. Then they won't do anything for you. They won't do massage. They won't do any physiotherapy or exercise. Guide you to do some exercise now. Nothing at all. Just go home and put ice pack. That is something that the best suggestions. But today I'm going to show you some point that you can do something, which is acupressure point on the distal area, not the local area, not the pain area, to instantly relieve the pain. What you may do, the doctor may suggest you take painkiller, right? Yeah, painkiller is good for the pain, but it doesn't really treat the problem, help to recover. Right? You need something that actually will help the blood flow better to help the area heal. Without blood circulation, it won't heal. Now, our technique is distal acupuncture. Now, when it comes to acupuncture, acupressure point, we have a lot of different strategies. One of them we call local acupuncture point, which is, you heard here, you can do some point around there to get relief, But on the other hand, what is the acute problem? You just hurt yourself, you injured yourself, you get swelling, and you don't want to do it here. Why is that? Because you may make it worse. That is why physiotherapists, they don't want to do any work for you. They send you home, come back after a week, things like that. There's no treatment basically, apart from painkiller, ice pack. That's it. That's it. Right? Or may give you some support. Things like that, you may still in pain a lot. It may keep you awake. You may not be able to go to work. Or you may be able to work or walk on it, but it's such a lot of pain, even with painkiller. This is something that is useful, we call distal acupuncture. If you come to us with a needle here, or we do scalp acupuncture, we do here, or we do the opposite knee to target the pain over here, or to help the sweating goes down. Well, the theory is in here. You see a lot of meridian, and here all this line we call meridian. And this meridian is connected to those meridian in here, and here, and in here. So by doing massage on the opposite side here, or here, it can actually relieve the pain here and actually improve the circulation over here. Right. So this is the theory. Now think about it. Probably talking about meridian is still difficult for you because you don't know what meridians are. A common saying for you: have you ever seen that people don't have? They born without hands, When those people born without hands, there's no hands. How could they eat? They use the leg as their hand to dress, to eat, to wash clothing, to carry bag. You know what I mean? So the legs is the hand. Let me show you what that actually connected. We call this image. It also is what we call I can't remember the theory, homographic, some graphic theory. I can't remember the name actually, but it's an image. So this is the image. This is the leg, right? This is the arm. So you see fingers. What is it? Toes, hand, foot, ankle, wrist, elbow, knee, hip, shoulder. So when you look at that, which means knee can treat elbow, elbow can treat knee. Let me show you very, very simple strategy that can help to relieve the pain. Holographic. Yeah, that's right. Holographic, something like that. Thank you. Well, this is the arm, all right? Elbow. So look at the elbow. So you bend your elbow a little bit, then you can find that there's a tendon over here. There's actually a tendon in there. Definitely a tendon. So with that tendon, what are you going to do? Tendon in the outside of the tendon, that is on the thumb side. On the thumb side, you press on it. If you hit the sensitive point, give it a rub. Get up to 30 seconds. And then you go toward to the fingers, about 4 fingers. 1, 2, 3, or 4. Around here, if you can hit any sensitive point, get it rubbing, right? And then you go up toward to your shoulder. Another 4 point. 1, 2, 3, 4. Right, 4 points from here. 1, 2, 3, 4. If you can hit any sensitive point, give it a rubbing over here. So it's that area. Why that area? Because when you hurt your knee, it's not just level. It normally come with up to here, down to here. So I don't want you to miss any points. I don't want you to miss any point. All right. So with this is lung meridian. It can treat field meridian. If you're an acupuncturist, put the needle in. Simple. Right. It can treat, for example, that meridian. It can actually treat here on the back side here, that meridian. It can treat the spleen meridian as well. It can also treat the liver meridian. But hey, as a patient or if you're not an acupuncturist, you don't need to know about the meridian. You just need to know the image. You just need to keep thinking that elbow can treat knee. That's it. And I'm going to show you one by one. You just find all the point. Any point is sensitive, massage it, and it will help. It will definitely help. Okay, I guarantee you. The next one, still in tendon. So we're talking about on the thumb side, right? Now on the little finger side. So to that side, which is little finger side, there was that thumb side, and on the tendons on the little finger side, right? Again, do the same. If there is tendon spot, we call RC point. Give it a rub. And 1, 2, 3, 4. That's it. From here to here. And up here. 1, 2, 3, 4. Right? That makes sense here. I hope that makes sense here. Okay, the last one. So 3 different meridian. Bend your elbow fully. And in the end of the crease. That one. And 1, 2, 3, 4. 1, 2, 3, 4. 4 point. 4 point above, 4 point below. Something like that. So rubbing over here. 1, 2, 3. Those 3 meridian be able to help all the knee problem. But of course, when you rub it, you feel better. You straight away get better. What are you going to do? Do it once a day or whenever you feel the pain. I'm not saying that once you do that, you're going to be perfect. No, it's not, because you really get an injury. You want to help recover. So do it more often. It will definitely give you a relief. So you can do it on that side. You can do it on the other side as well. Both arms, either side. Now, Alternative, you can go, so I just show you that, right? You can go actually along here as well. That is more bony. It's much difficult to get to the point, but it still works. If you can be patient, go a little bit, a little bit, a little bit, a little bit from here. 1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3, 4. Cover all here. So this is distal point, distal acupuncture to treat the knee problem, to help your knee injury recover. Now, we're talking about acute injury, right? It can help actually chronic issues. If you have arthritis knee, if you have any apart from arthritis knees, you can if you have old injury and you get pain, now it's become a chronic. It's not it's not an acute problem. Or arthritis when it's raining, when it's coming, the weather's cold, or it's gonna rain, and you feel the pain in your knee, and that's something that you can do. It's very, very simple. Right? If an acupuncturist, the point that's sensitive, instead of pressing on it, needle it, because it works better than acupressure point. It works better than acupressure point. And this is just one of our strategy that using elbow to treat knee. We have other strategy here, scalp acupuncture, on the tummy, on the back. There are a lot of strategies, or just fingers. There are a lot of strategy that on distal point that can help your knee. Now, if you, so I'm saying that you get relief, but if you don't get much relief, leave your measures down there, and I'll figure out another way for you. Okay, but if you're not confident for yourself to do the acupressure point, go and see an acupuncturist. And if you're in Hamilton or Cambridge or Raglan, come to see us. Right? Our phone number is 078467956, 078467956. So we open from Tuesday to Saturday. Now, unfortunately, tomorrow is holiday, so we're closing tomorrow on Saturday, but we will open on Tuesday. So I see that some people were on YouTube. We have 5 people in here. Please give me a thumbs up, and say hi to me, remember, and share this live video to your Facebook. I believe this live video will help. This simple strategy will help a lot of people. And my goal is to help as many patients as I can. So I want you to help me to reach my goal. And thank you very much. Thank you for saying hi. Nice support. Thank you. I'm going to do this live video every day, and we're going to cover the whole body, and it's very effective. Very effective. And again, one strategy is not enough to cover everything, to fix everything, right? And you really want to fix it, go and see an acupuncturist, right? I recommend you, no matter where you are, go and see an acupuncturist. Now, if you find it works, but you want it works even further, you run out of a magic point, just leave a message there, and I'm happy to share more. If you're a patient. Okay, that's it for today, and stay awesome, and remember to give you a thumbs up and share this live video. Thank you very much. I'll see you next time. Bye bye.